First, let us ask the woman behind the camera whether she has done her pap smear.
Yes, ma'am. This last year.
Okay, that's good. Hello, myself Dr. Abhilasha Narayan, consultant Gynaec Oncologist at HCG Bangalore. Today we are gathered here to break some myths around the pap smear test. Okay, then I'll start by picking up the first chit or the first myth. And the myth here is whether pap test is an STI test. STI means a sexually transmitted test. Well, it is not. Pap smear is done to rule out whether you have a precancerous lesion in the cervix. That is a screening for cervical cancer, and it is not a sexually transmitted infection test. I'll pick out my second myth of the day here. I don't need to get a pap test. I love only one partner. Cervical cancer is not exclusive to women who have multiple partners. So it can occur in women with one partner also. I think all women who are sexually active should get yourself screened with pap smear, and not just because you have multiple partners or you have an STI or you have a single partner for that matter. Coming to the third myth. An abnormal pap test always means I have cancer. Sorry to say no. A pap test actually doesn't detect cancer. It does detect, but most of the time it detects any precancerous condition. That means to say it will tell us whether you are predisposed to get a cancer. So if we treat it appropriately, detect and treat it appropriately, we can prevent cancer from developing. So no, pap test doesn't always detect cancer. Coming to your fourth question, getting a pap smear is always painful. Definitely no. It does cause some discomfort, and also based on your sensitivity level, some might not even actually have even the discomfort. So pap smear is not a painful test. Please go get it done once in 3 years. This is my advice for all sexually active women. This is the last myth of the day. I've taken HPV vaccine. I don't need a pap test. HPV vaccine does prevent HPV viral infection, which is known cause for cervical cancer. But the vaccine only provides protection for certain number of viruses. There are very other rare viruses which can cause cancer. So even if you take cervical cancer and there is vaccine and there is some protection, it is not absolute protection. So all women who are vaccinated should undergo regular pap smear screening regardless of vaccination. The way forward is please go to your Gynaec or your Gynaec Oncologist and get your regular pap smear screening done.